Welcome to Managing Sexualised Behaviour Awareness Raising for all staff. This presentation will support all staff to deal effectively with incidents of sexualised behaviour and is based on the Forth Valley Managing Sexualised Behaviour Guidelines 2013. The guidelines have been developed to create a consistency in approach for all staff, which in turn creates a shared understanding of managing sexualised behaviour. Sexualised behaviour can be a natural, healthy part of growing up. However, some children and young people may develop inappropriate, problematic habits or display sexually harmful behaviour. When this happens in school, staff may respond to these behaviours in different ways, which can be confusing for the child or young person involved. Intervention at an early age can prevent ongoing behaviour issues that may continue into adulthood, when they may be viewed as a public nuisance or at worst a sexual offence, for example, masturbating in a public place. The policy values of this guidance are firmly embedded in legislation and reinforce that sexuality is a natural and healthy part of who we are. Each of us feels differently about our sexuality and we may express it in different ways, without harm to others. The management of sexualised behaviour relies on staff using their professional judgment and knowledge of the child or young person to establish an appropriate course of action. Management of incidents should take a step-by-step approach. There are 8 key steps to this approach. Step 1. Identifying behaviour. Certain behaviours may not appear overtly sexual, and different situations and contexts may cause more concern to some staff than others. Identifying sexualised behaviour in children and young people requires an understanding of what is age and stage appropriate. Early years. Age-appropriate behaviour. Touching or rubbing own genitals. Concerning sexual behaviour. Continually wanting to touch the private parts of other adults or children. Very concerning sexual behaviour, forcing other children to play sexual games. Primary. Age-appropriate behaviour. Conversation about sex, genitals, dirty jokes. Concerning sexual behaviour. Sexual knowledge too advanced for their age. Very concerning sexual behaviour. Simulating intercourse with peers and forced exposure of others' genitals. Secondary. Age-appropriate behaviour. Sexual activity, for example, kissing, heavy petting, consensual sex. Concerning sexual behaviour, preoccupation with pornography, sexually aggressive themes and obscenities. Very concerning sexual behaviour. Degradation, humiliation of self and others, for example, forced physical touching or injuring of another. For more examples of age-appropriate behaviours, please refer to the Managing Sexualised Behaviour Guidelines. Step 2. Initial response. Consistent approaches including language. What you say, how you say it, when you say it, should be used by all members of staff. Receiving mixed messages creates confusion. It is important that staff do not allow their own embarrassment to cloud their judgment. Possible responses. There are a range of possible responses when dealing with incidents of sexualised behaviour. Schools should develop their own checklists to reflect the needs of their staff and young people based on the Managing Sexualised Behaviour Guidelines. It is important to consider the rights of the young person, their sexual orientation and additional support needs. Step 3. Assess risk. The first assessment of risk will be undertaken by the member of staff at the scene who witnesses the incident or has concerns. They should ask themselves, is this behaviour which needs to be addressed but is not child protection? Is this a child protection concern? Step 4. Record. Incidents of behaviour will be recorded in line with the school's own policy on behaviour child protection. The benefits of recording all behaviour is that the situation can be assessed by a number of people, rather than being the sole judgment of one member of staff. It can also identify repeated and habitual behaviour, monitor interventions, progress and identify additional support required. All efforts should be made to help the young person to communicate their own account of events and an explanation of their behaviour. It may be appropriate to have the views recorded of those affected by the behaviour. Staff should remember that all information will be shared. Step 5. Assess need. When several behaviours are identified as inappropriate or offending, staff must think about why the child or young person is exhibiting this behaviour. There is a need to consider the whole child. This is best done in collaboration with parents and carers and other staff and professionals. An assessment may require no intervention if the behaviour is healthy and natural. Step 6. Action Plan. The targeted intervention will be driven by the needs of the child or young person. The action plan may involve parents, carers, professionals, partners and other agencies. For the majority of children and young people, targeted interventions are more successful when delivered by people they know and understand them. This may be a parent, carer or teacher. Step 7. Follow-up or intervention. This diagram is a general guide to determine when no intervention is required, when the intervention can be managed within the school environment and duplicated and/or completed by work at home, when further discussion with appropriate agencies may need to take place when a referral is required. Step 8. Review. Once the intervention has been designed, agreed and delivered, a review date should be set to monitor progress and plan next steps. For more information, contact your local health or education officer.